Hello and welcome to 16 and Under on Branama TV. My name is Diane Olatunde, and today we'll be talking about the state of mental health, especially when it comes to young people. This is an aspect of our lives we do not even know much about or even discuss. But the young people is something they've had to deal with all the time without proper investigation or even attention. Today we're going to be discussing this in details, and joining me to shed more light on this issue is Tlhapane Basha, a registered nurse and a child counselor all the way from Cape Town, South Africa. We all talk about this mental health and everything, and some of us, we use it, but we're sort of not so clued on when it comes to the true meaning of mental health. So for those of us who don't really know, what is mental health and what is the ideal mental health status, especially for the younger people?
So obviously for the younger people, for the longest of time, mental health hasn't really been so much of a priority. We have always known something is wrong. If it's happening to an adult, a person that is in the capacity to either be diagnosed or even be admitted in an institution. So very rarely you would find a pediatric patient in a hospital admitted due to mental health diagnosis or any other challenges, therefore. So mental health in general is the ability of a person to be able to manage day-to-day activities, right? Is to be able to live a fulfilled life without hindrances. And I want to simplify it so that we don't go quickly into the medical jargon so that people can easily say, but I don't fit in that category. So a minute a person is not able to cope on a day-to-day basis, they're not able to carry out their normal functioning. And then that is when we say they have a mental health condition. And it could really go from just depression. It could go from any other diagnosis that could relate to the state of their mental health. So obviously words like depression have been thrown around, especially around young kids. When a young person is feeling a bit down or maybe struggling just generally to cope with just the pressures that comes with a young growing person. And then they would just as easily say, this person is depressed. Obviously, that would not be a correct clinical thing to say. It's a word that is used, but in medical terms, it's a word that needs to be only placed upon a patient after a series of investigation has been done. So we don't really reach a conclusion that a person is depressed by mere virtue of talking to them or just looking at just minor signs and symptoms. So with young people, when we see a young person struggle to manage, the day-to-day functions of school, this will be a learner that is struggling at school, or this is a learner that is not coping with their health overall. This is when we know that there is a mental health challenge that is at hand, and it requires a professional to assess and to conclusively give that diagnosis.
Looking at the world today and what we are dealing with, the main thing is the COVID-19, and it's really dealt with so many people, adults, young people especially, and not a lot of attention is paid to how it's affected the young people. So they said, well, it hasn't helped anyone, but how bad do you think young people's mental health has been affected by the COVID-19?
If we were to look at it in a cluster of sections, school-wise, we have seen that there has been a rapid decline in academic performance. And obviously, that was as a result of, learners not being able to physically be at school. But there has been a huge decline in academic performance. So most of the educators have brought the issue to book to say, look, we have seen that even the most cleverest child in the class would really perform so poorly now as a result of, since COVID happened. And in medical terms, we've also seen a huge increase of young people that are admitted in hospital. So, our wards are not so busy, unless the little ones with just your general ailments of children that are younger than 6 years old. But we have seen a rapid increase of younger people that are coming with diagnoses that we were not able to conclusively put a name to them, so it would be difficult, to know if a child says, I've got abdominal pain and the pain is not going away. And we perform all the necessary investigations, we palpate, we auscultate, we do the bloods, we take other samples. Even in some extension, the child will be taken for other laparoscopic screenings to look into the abdomen. They will not find anything, and the child will persistently say that they've got abdominal pain. We have also seen an increase with children saying they've got headaches, an 8-year-old saying they've got a headache. It's a very rare thing to hear. But since COVID happened, we have seen those kind of diagnoses flare up and happening in a number of children, not just a few. So in a number of children. What we have also observed as well is eating disorders, which is something that in the past was such a stigma, it was such a taboo. You would rarely come across a child with bulimia or any other eating disorders in the unit, in our hospitals. But now we have seen many children, both boys and girls, with eating disorders. And obviously that falls under the category of the struggles that young people are having to face, dealing with COVID-19 and the inability to cope, because we also have to recognize that when adults are not coping, children will also not cope. So it's not really just a burden that we can place only on children. So we have seen that happening. And we have also seen an increase in teenage pregnancy. So a very high activity of sexual activities happening around younger children. And this is not in relation to anything unlawful from the stance of, sexual assault. If the child was engaging in such activities with a major, which would then constitute to being, rape. But in this instance, we have seen a lot of younger people engaging in sexual activities at a very young age. So they would come in the clinic and they would be 12 or they would be 14, and they will be speaking to you about their interactions sexually, which is not something that is so common. Yet again, we're not saying it wasn't happening, but now it's like sort of a lot of numbers of children are sort of coming forth, and they're either pregnant or they are diagnosed with HIV, or they are found to be sexually active, which is also something that we had to look into to say, instead of really pretending that COVID-19 didn't affect children, how about we provide services for young people for therapy so that we take them through the process to manage, because this was just a very stressful time for everyone globally. It was a frustrating time. And to the most of the young people, they've also lost loved ones in the family. There's a loss of income in the family. Some of the children had to change homes. They had to change schools. There has been quite a huge adjustment, a huge burden that has been placed on children. So of course, mental health issues began to be now a bigger problem for children.
When you talk about these children, is there a dominant age gap that this affects more than the other?
Typically with the young ones, it would not be as severe. It would not be as severe, but with the older ones, it would be only as severe as coming to a place where you would find a 15-year-old pregnant. And this is when we know we are really sitting with even a bigger problem in comparison to, a 7-year-old that, doesn't want to go to school because the tummy is sore, we are scared, we are fearful. And this is where we would sort of introduce therapy from the spaces of having to speak to mom. Because, if you've lost a loved one in the family, the child will be scared to go to school and be separated from loved ones. So having to really rehabilitate a home will take a bit of therapy, in that specific home. So if it's a 15, 14-year-old that is pregnant, then it's another thing altogether.
In most cases, parents do not understand when kids say, I'm not coping. So what's your take on this? How do you counsel or advise them when this happens?
Look, it's very common when parents are in a position where they don't really understand anything about mental health because they themselves had to grow and adjust and deal with so much by themselves without any form of intervention. And it's not that they are coping, because in most homes you would see with the parenting style that, there isn't really much coping happening. If there's a lot of beatings, there's violence, there's abuse. So really, there isn't really much coping. There's still a lot of hurt and trauma in that particular family. So our way of doing things has always been health education in the family. So we don't really introduce mental health from the stance of really bringing a fear or the concern over the family. Let's say, for example, in a family where a young girl has got a particular challenge and they're not coping, then we educate, the mother and the father about what is happening with the young person. And then we also give the young person therapy so that they can also adjust and cope with what they're dealing with at that particular time. Like now you see the results are being published. We already have new cases of young people that didn't do well at school. So we have to educate, the parents and let them know what goes on in the mind of a young person that was not able to successfully complete grade 12. So health education becomes one of the biggest and most important thing that we do as a practice to make sure that, parents are aware and not just parents, but the community at large, be in a space where we have an understanding and we can really extend that courtesy to young people. We obviously, as a family nursing practice, we introduce health education to the entire family, which means that we educate first the parents about what the child is going through, and then we introduce, mental health to the child themselves that is struggling. And often you find that when you do provide such services to the child, obviously there is a story behind the story. And this is where you would find that either the child has gone through a traumatic experience, and therefore, when you have introduced a space, a healthy, safe space to communicate, when such things come out, the child feels a bit safer, because then when mom or dad finds out what's going on, there's going to be a bit of safety, and it's not really going to cause any more problems, that sort of a thing. Yeah, because whenever young people are stressed, it's because they are worried about the reaction of the parents, or they are worried about, the welfare of the entire family as a whole. So most of the time, the things that they are worried about, through therapy, we are able to sort of unpack all of that, process that, and introduce the family into that communication space and create, even a more healthier, a family when it comes to mental health.
As a parent, I'm a mother myself. What are the common signs that we should watch out for when we're talking about trying to see what's going on with my child? What are the common signs that we should watch out for?
Right. The signs will obviously differ according to the age, right? So if a child is at a certain age, just over 9 years old, it's quite easy to see when there is something that has sort of changed or shifted, because they were already in a very strict regimen. They were already in a strict routine that they are going to school. So they have to perform at school. And so often it's very easy to monitor or to observe that there's a bit of a change when a child is less interested in going to school. They are always fatigued. They are cheery most of the time. They are rebelling. They are very angry. The use of inappropriate language in the family, in the house, a language that is not often used. Like some homes, you will not hear, derogatory language. So a child would all of a sudden start saying a very bad word in an environment where they know they cannot say something like that. And just outburst as well. So you always have that situation where something as minor as I asked you to do the dishes resulted in something as big as a child even saying, I don't want to live anymore. I want to die. I want to leave home. You don't love me. And so whenever that kind of vocabulary is verbalized by the child, that is when you know you are really sitting in a challenge. And also when a child is remotely isolated, I always say just observe when they are remotely isolated. When they enjoy their own company to a point where it is uncomfortable for you as a mom or a dad, you should actually be worried, because they are too much in that space where nobody really can monitor what they're doing. Because some children can struggle with mental health, but they can perform at school very well. They could get 80%, 90% at school. So we really cannot measure a child that is not coping just on the radar of academics if the child is performing poorly. However, you might find that the child that has been performing very well, all of a sudden they lose their grades, everything starts crumbling down. And this is when you know something is not right. So just your day-to-day functioning at home will be a telltale that something is not right. To toddlers and children of a younger age, you see often with a change of appetite as well. They often either want to eat at all or they just want to eat excessively. They struggle with sleep and they have severe separation anxiety. When it comes that time for a child to go to creche or to go to school, that is a very traumatic time for the child. So you have to look at the cues as a parent. What is it? Where is it that the child fits in, and observe a change of behavior as well.
Looking at the sequence, or sort of from the time COVID started and now, I can say, I stand corrected, that we've sort of gotten into the rhythm or the swing of things. Can you say the kids are coping better now, or has anything changed, or is it still basically the same from the beginning to now?
With the teenagers, on our numbers, with the teenagers, nothing has changed. But with the little ones, it looks like, things are more or less sort of starting to transition with a bit of ease into how things used to be, more or less. But with the teenagers, there's a bit of a strive, there's a bit of a struggle there, because most of them, when COVID, when the dust started to settle, they were pregnant. When the dust settled, they were mothers. When the dust settled, they had, HIV statuses. They had to take, treatment for other things as well that, young people are not supposed to be going through, such, challenges medically, So it's almost like for them, their journey continues, because now that 16-year-old is a mom now. So from what happened, during COVID up until this point has resulted in them not going to school anymore, being a mother, and really having to face life like an adult. Wow. So not much with teenagers has changed. Yeah.
What should parents do? Should they see signs that their children are struggling to cope? It can be at school or at home. How do you begin to, like now you've mentioned some of these signs, and when I see it, that my child is experiencing some of these, where do I start from? What's the first step? What do I do?
It depends on the dynamics of a family. In South Africa, we've got such, we are so diverse, as a country to a point where, you could have a family that lives in a farm and it's just one room and it's 12 people living in that one room. And then you can have 8 people living in a shack and it's been their household for the past 20 years. And then you can have, a family of 4 that lives in a double-story house and everything else is at their disposal. And, and obviously mental health affects everyone from that family in that one room in a farm to the mansion, so no one is exempted from really experiencing the challenges of life, whether being, rich or poor, so when a family obviously is confronted with this, I always say, look into the spaces of the family, what works, and this is where I always say, if the family is Islam or faith, introduce your faith into the spaces of creating a support network, because sometimes the support network can help, alleviate the pressure of that particular family, because you might find that the young ones are not coping because maybe there's no food in the house, maybe the mother is not there and it's just the oldest is only 16 taking care of the rest. So whatever we can introduce in the family needs to be accessible to that family. So telling a family that doesn't have an income to, approach a psychiatrist. It's almost at 2,500 for an hour to see a psychiatrist. It's not possible. Neither is a psychologist, which is a very impossible thing for that family. And there is a family that you can provide that advice to because they can afford, and the resources are very close to their disposal. So other families, I always say, approach, the church, approach the community center, approach, the non-government programs that are available that do offer such services for free. And obviously, organizations like SADC, organizations like FAMSA, they will be able to provide a huge extent of support towards that family by making sure that the social worker, attends to the needs of that particular family. So you obviously have to look as to the psychosocial status of that family before you can give that advice.
What advice do you have for those watching? What's general? Is it maybe coping mechanisms or anything? Just an advice to parents, to the young ones, to everyone that is affected. Of course, definitely everybody is affected. So what general advice do you give to those watching this program?
I always say that, reassurance goes a long way, and reassurance is the best therapy you can give anyone. So to parents that are finding themselves in that situation where children are not coping, it's best that you verbalize certain issues to the children, obviously not pretend that it's not happening. Let the children know that the situation is going to be much better. Inform them about other things that are being done to improve the situation. Continue to encourage them. And also just integrate, the notion of always telling children how much you love them and how much they mean to you. Because if you're able to do that, and I think you have already sort of chopped that tree halfway through by being able to reassure children in the home, that is the best therapy, when a parent is present enough to be able to reassure the children. And yeah, so that is the advice I can give.
So there you have it. We've heard from the professionals, Sister Tlhapane Basha, all the way from Cape Town, South Africa, telling us how we can handle our mental health status, especially in this COVID era, especially for our young ones. Mental health is a part of our physical health. We cannot afford to view it as otherwise. It is time to break the silence and begin to address it accordingly. Thanks for watching, and don't forget to send in your question and anything you'd like us to discuss on this platform, 16 and Under on Branama TV. My name is Diane Olatunde. Bye for now and take care of yourself.